So, Bob, I have a bunch of questions here for us, and I want to clean house and actually do lightning round this time. So, famous last
Hope
words.
springs eternal.
Huh?
Hope springs eternal.
Yeah. Anonymous says, "Hi, Kirk and Bob. I recently ended a relationship with a woman who I strongly suspect has undiagnosed borderline personality disorder. A lot of common patterns showed up, like threats, false accusations, suicide notes. In between her bouts of intense victimization, it's interesting to see fleeting moments of self-awareness and apologies for how she treated me. Even though I have to remove myself from her life to protect myself, I still love and care about her very much. I feel so sad that I was not able to provide a corrective experience for her, and in the end wonder if she's only ended up re-traumatized by me, quote-unquote, abandoning her. She's in therapy for a specific trauma that happened to her, but I know she lies in therapy. She deceives in therapy. And I'm not sure that anyone is aware of the probable borderline diagnosis. Is there anything I can do to help? Bob, what do you think?"
No, I don't think so.
Yeah.
You know that old Zen parable about the guy with the horse? You know, the guy, the farmer, you know this one. So you don't know that you leaving is a bad thing. All you know is that you did what you needed to do for yourself. Fine. It's good to observe your own limits, and there they are again. It could be that that's a catalyst from which she'll grow. Who knows?
Yeah. What I would say is that you care a lot about this person and you feel bad, and knowing what you know about the condition, which may or may not be present in this individual, but if it is present, then yeah, you might have added to the trauma by leaving her. But that's not your responsibility, and on the grand scheme of things is just a drop in the bucket regarding the amount of trauma that contribute to her condition. It's also possible that it didn't actually re-traumatize her. You know, it might have just been a difficult breakup, and there's that sort of thing. The thing that I would say, Anonymous, is I would watch out for you being too much of a pleaser. Now, there's a possibility that you're just a nice person who also recognizes your own needs, but the fact that you say, you know, I feel so sad that I was not able to provide a corrective experience for her. Yeah, that's not your responsibility. It is something that we do for each other in romantic relationships, but hopefully you're just saying that out of like the healthy way that we all want to be a corrective experience for our partners, and not some sort of feeling of responsibility for solving everyone else's traumas, because you're never going to be able to do that. Yeah. And also the fact that you're asking after breaking up with her, how can you help? And I think part of the assumption is like, I think you might be asking is, should I contact the therapist? Because, you know, my client, my ex-partner is, according to you, lying to her therapist, which is pretty normal. And if the therapist understands and is competent, then they detect not quote unquote lies, but, you know, distortions, or the client isn't ready to go to a certain area or something. And, you know, because sometimes people will come to me, this is more in the past, and they'll be like, yeah, you know, I know my sister's in therapy with you, and I know that she's lying about this and this and this to you, and I know you're tricked by it. And, you know, I would always think, I'm not being tricked by, I'm just not blasting them every session, because it's not going to help, you know, just because I don't confront the client on everything that I hear that is questionable. It doesn't mean that I'm not noting the possibility of distortion, you know what I mean? So it's just hard to know. And yeah, to simply answer the question, as Bob said, yeah, no, there's literally nothing you can do. I mean, if you're friends with her, you could just tell her how you feel, I suppose, and you could maybe throw the word out of just like, I think there's a possibility that you have some relational traumas that you might benefit from. I mean, you could throw that out there, but, you know, you could imagine that being pretty annoying to hear from someone that just broke up with you. So, yeah, there's probably not anything you can do. Anonymous Annual Patron says, any book recommendations for a layperson to learn about psychodynamic therapy? The only psychology books I am currently reading are Rogers on Becoming a Person and Phil Cushman's book, Constructing the Self and Constructing America. End of email. So do you have any particular psychodynamic books? Because I have a bunch listed here.
Well, Irving Yalom's a good writer. You can read some of his novels, or, you know, anyways, that's all I got, though.
But does he have a specific psychodynamic book?
No, but he's written some novels that are psychodynamically informed.
Yeah. Freud, Nietzsche.
When Nietzsche wept, lying on the couch is fun.
Okay. Yeah. So, it's interesting, anonymous annual patron, that you're reading Phil Cushman's book, my mentor. I'd be curious as to how you're receiving it, because it's pretty complicated. I mean, if you're reading it as a layperson, I could see it being more enjoyable, because as a student of his and a mentee of his, I was required by definition to actually fully understand what he was saying all the time, which was very difficult. At his memorials, I've been to a couple of his memorials, and the common thing that a lot of his students would say is just how difficult it was to understand him, but he was talking at such a high level, but eventually, you would kind of get it sort of anyway. But the books that I would recommend that I have on my shelf are Interpersonal Process and Therapy by Tabor and McClure. I believe there's no mention explicitly of psychodynamic therapy in the book, but it is absolutely a psychodynamic book, but they frame it as interpersonal. I even asked the authors, I said, so is your book psychodynamic, but you just don't say it? And they're like, yeah, essentially yes, but we just were trying to avoid that label because it's so fraught, But yeah, Interpersonal Process and Therapy, it's a very particular angle of psychodynamic therapy, and very in line with the way you and I think, Bob. Another book by Ogden, which is a great author. He's a great author of the way I think, a book that is called Projective Identification and Psychotherapeutic Technique. Also a book by Nancy McWilliams called Psychoanalytic Diagnosis. It's kind of a standard book in psychodynamic thought. Another book, David Wallen, a book called Attachment and Psychotherapy. It's not technically a psychodynamic book, but it is definitely in my book. And also a book by Michael Kahn called Between Therapist and Client. Again, not explicit psychodynamic, but it is very psychodynamic and is very easy to read. If a layperson were to read something, I would say Between Therapist and Client by Michael Kahn, because it's a paperback, it's pretty short, easy to read, great book. Raven says, how could the MMPI get it so wrong? So MMPI is the psychologist. It's the main, what they call the gold standard of personality assessment. And it,
what is it? Minnesota
multiphasic personality inventory. When I was 17, I took the MMPI as a part of my parents' plan to try to understand why I was struggling emotionally. The psychiatrist told us that I was schizophrenic and likely to be unable to even fully understand normal social cues, and that potentially I would need some kind of care by the time I was in my 20s. Nothing could have been further from the truth. I am now 47, currently in therapy, and have never experienced anything remotely resembling the mental illness of schizophrenia. It took me years to reveal and begin to heal the deep wound this pronouncement of my eventual mental incapacitation left on me. How could the MMPI be used this way, and how could it have been so wrong? So, thank you. End of email. What do you say, Bob?
I have no idea. Never took it. Don't know how to give one. No training in it whatsoever.
Yeah. The MMPI is a tool. It's not a diagnostic. You can't rely on it diagnostically. You can't administer an MMPI and then just diagnose someone from that. You need to interview the person, especially specifically with schizophrenia. You would need to, really investigate things, because the schizophrenia scale on the MMPI can mean a lot of different things, and any expert on the MMPI knows that. People can score high on the schizophrenia scale, and it could mean the person has schizophrenia. It could also, and more likely, honestly, it probably statistically means other kinds of things like creative thought. I'd have to look at the literature on it again, but it's hard to know how it went wrong, Raven, for you, because the way you're remembering it is that you're 17, you took the MMPI, the psychiatrist concluded just from that you had schizophrenia, or you were going to develop it. It's possible that they were also utilizing a lot of other techniques to assess. It sounds like they were wrong. So there's two possible stories. The less likely story is that you were presenting at the age of 17 as someone who was classically pre-schizophrenic, and the psychiatrists were tentative in their diagnosis, but you received it as a firm diagnosis, or your parents received it as a firm diagnosis or something. That's less likely given your story. It's more likely that what happened was that the psychiatrist administered the MMPI, but they also asked a lot of questions, talked to your parents and whatnot, and falsely concluded that you were definitely going to be schizophrenic or develop serious symptoms later on, and irresponsibly spouted to you and your family that you were definitely going to develop schizophrenia in the future. It still happens to this day. There's bad clinicians out there, and so that happens. I have a similar story, actually. When I was about 7, we all have eye doctors because aside from my younger brother, everyone in my family, we wear lenses. And so I was going to the eye doctor. I was 7 years old, and the eye doctor was a quack in addition to being an eye doctor. He fancied himself a child psychologist, even though he had no training, obviously.
Unbelievable.
And so he had this playroom with a one-way mirror, and he had me go in there. So he assesses me, and then he goes to my mom and dad and sits them down and says, so right now, Kirk's doing okay, as developmentally and academically and cognitively and emotionally and psychologically. But very, very soon, he is going to decline and become, he's going to fail out of school. He's going to have all these emotional problems. I don't know what he's even referring to. I mean, at the very least, Raven's quack psychiatrists were referring to an actual thing that happens, schizophrenia.
Yeah.
This eye doctor, I can't even figure out what he was thinking of.
Yeah.
You know what I mean? Like
Yeah.
that pre-pubescent shift in personality and academic experience, like academic abilities, like what? Anyway, but he sits my parents down and he's telling them this, and my parents are scared. And then at the end, he's like, so I want you to sign up for my program. And that's when my parents were like, oh, so they didn't sign up for the program, but they also were like, well, he's the expert. And then they just watched me very carefully. The opposite happened. When I hit the age that he said, 5th, 6th grade, was when my academic ability skyrocketed, because the shift at that age is away from reading and towards math and science. There's a lot of reading, a lot of reading out loud, a lot of reading books, a lot of comprehension stuff when you're in the 3rd grade, and a lot less technical STEM sort of things.
Right.
But 5th grade comes along, and I think I'm a dumb kid, and I take a placement test for math and science and other things. And I was in the Smarty group. And I remember when they told me that, they're like, okay, these are the kids in the advanced class, these are the kids in the average class, and these are the kids in the remedial class. And I thought for sure I was going to be in the remedial class, but I was in all the advanced classes, and I was like, huh. Anyway, the point is that this was a quack, and this was someone that didn't know what they were doing, and that happens. And I hope that was more of the thing of the past, when there was a lot more quackery and a lot less ability to find research and a lot less checks and balances. Because, I would like to think that if someone like this existed today, that there would be a bad Yelp review or something that would out them, or I don't know. But I'm sorry you went through that, Raven. And the difference is, for me, Raven, and you, is that no one told me that I was going to be a screw up. And imagine if they had it. What if that had been a self-fulfilling prophecy at some point? But for you, Raven, they told you. They said you're doomed. And just imagine that, being told at 17 that you're definitely going to develop schizophrenia. How terrifying that would be.
That you're not going to be would I apply for college? Would I have any kind of ambition for myself?
Yeah.
What would it do? It would torpedo it, maybe,
Yeah. I mean, not that you can't treat schizophrenia with, proper medication and stuff, but
yeah.
But it would be...
But that guy's not saying, and there's treatment for it. That guy's just saying you're going to be, basically...
You're doomed.
Yeah.
And
blech.
Yeah. I mean, if someone told me that and I understood what schizophrenia, like today, if someone told me you're definitely going to have schizophrenia in a couple of years, like that would be one of the worst things you could ever tell me. I mean, people can have schizophrenia and recover and live wonderful lives, but I know enough about schizophrenia and I know enough about the experience of it to know that it is horrific. It can be horrific.
It's not enviable. No.
Yeah, it can just be really awful.
Yeah.
So to be told that and emotionally what that would do to you, I'm sorry you went through that. All right. Next question. Hi, Kirk. Anonymous says, thank you so much for your work on the podcast. Listening to it has really enriched my life and my understanding of myself. I wanted to ask if you had any recommendations for a person such as myself who was diagnosed with bipolar II disorder as well as ADHD. For instance, my struggle with executive function can often deprive me of the gumption necessary to engage in healthy activities that would help mitigate my depressive symptoms, like making food, exercising, and meditation. So, just chiming in here, they're saying I have bipolar II, which means that I have pretty deep depression and occasional hypomania and ADHD. And it's sort of a catch-22 because in order to help myself with bipolar, I need to have enough executive function to get motivated and follow through with things and plan. But the ADHD prevents me or makes it harder to do that. Also, the often mercurial nature of my bipolar disorder makes it virtually impossible to stick to rigid routines that would improve my ADHD symptoms. As a result, these days I feel as though I'm stuck between a rock and a hard place with no clear path towards a more consistent day-to-day life. Other than therapy, which I'm currently doing, I wanted to see what other recommendations you had for me, such as types of therapy, lifestyle changes, daily activities, etc. Thank you so much. Bob, any thoughts?
I don't have any thoughts.
Yeah.
This is just not my area.
Yeah. There's a lot to say, and you're talking with a therapist, so I would go over that. It's a lot of trial and error, I guess, is what I'd say, Anonymous. There, without getting into sort of the weeds on this, I would just say I know people with bipolar and bipolar II who also have ADHD, and they do eventually find a routine. And it is important to have a routine, habits, and this kind of stuff, systems in place to help with both disorders. And you just have to trial and error and believe that you can achieve that you're not doomed is the point. So that's what I'll say about that. But I'm sorry you're going through that. I mean, they do compound these disorders and can make things a lot harder. The other thing is just to go easier on yourself as well, and not say like I'm doomed and this is never going to work out. Anonymous says, do you have your favorite and least favorite clients? Do you have favorite and least favorite clients, Bob?
Didn't we already talk about this?
We did, but briefly again.
Somebody asked, do you have favorite clients? And we're both like, yeah.
Yeah.
So, the opposite is true. Do you have people that are not your favorites?
Because, some people would say, well, but you're not supposed to have clients that you don't like, or you're not supposed to rank your clients. So what do you say to that?
Well, I don't really go around ranking my clients. There are people that I am intrinsically more drawn to and less drawn to. Though one thing I've learned is my first impression is often just completely fucking wrong. Like I'm thinking of somebody that I met, somewhat recently, sometime in the last year, or whatever, and started working with, and I didn't think I was going to like them at all. I like them tremendously. But my first impression is just, I've learned not to trust it. And then, my belief about my job is that it is essential to see the good in people. Mm-hmm. I don't like using that word. It sounds like it's, to take a non-judgmental approach towards people and a basically empathic approach, and to imagine how their behavior or their point of view, how it makes sense given their context. Mm-hmm. Not that absolute truth, not that, but just like how it makes sense. Mm-hmm. And to be interested and curious, even if I don't know. In fact, what I've been saying to people lately is our curiosity is more important than whether or not you have any insight. If we just keep our eyes open and be open to whatever it is, we'll learn. Mm-hmm. We'll learn. So that's what I want to do and want my people to do.
Mm-hmm. What I would say is it's a paradigm shift that you'd have to understand even to understand our answers to this question, because, and I can imagine some therapists not having this paradigm shift, but this idea of somehow having a favorite client or a least favorite client, maybe it's even similar to parenting with one's kids, right? That,
this is interesting.
You know what I mean? Like,
yeah.
That as a parent, you can have favorite kids maybe, but it's not in the way that I think it's often thought about, like where you would favor that person over others, mm-hmm. or that you would dislike one of your own kids or dislike one of your own clients, actively, secretly not like them and not want to be. That's very different from how Bob and I think and also will answer the question. So to be specific is like there are, in terms of least favorite clients, there are clients who I've worked with in my 25 plus years who, I'm not looking forward to meeting with them, but that doesn't mean that I don't want to see them. What is often happening is that these clients have tremendous issues personality-wise. Now, there are some clients it was rare, who were antagonistic towards me, who I would say, we're not, not on my favorite list. But often in those situations, they were brief situations, or it was a period of time in that relationship, or something was going on that forced, like a court mandated person or something like that. So, but that was rare. But in terms of the clients that are not that I would still consider to be quote unquote least favorite, these clients, if I were to lump them all together, are people that I kind of dread seeing. I see them on my schedule and I'm just like, oh, I have them today. But among all those feelings, and as I'm having those thoughts, but I can't wait to get into it with them because there's so much potential there. These kinds of clients that make me feel that way have so much relational traumas that there's a lot of transference and displacement onto me and a lot of resistance in therapy. And I decided to become a therapist for this reason. You could argue that this category of quote unquote least favorite clients are actually my favorite clients because that's why I got into this profession. People with borderline personality disorder, I learned I loved working with, but they are the most stressful. Really all personality disorders are extremely stressful. They tend to be much more likely to attack me. They tend to produce a lot of countertransference in me, a lot of shame in me, a lot of feelings of inadequacy. Literally a fight or flight reaction will happen with me as I'm talking to these people. That's not my favorite experience to have, but it is a result of real therapy, of real potential for change, of a great deal of ground to cover. And what a glorious thing, right? So it's a paradigm difference. And I think there are some therapists who actually don't have that paradigm shift, and their quote unquote least favorite clients are clients that they actively actually don't really want to work with, but they tolerate, and that's a very different thing than what we're talking about when we're talking about favorite or least favorite.
Yeah. I don't think I have any of it. I don't have anybody that I see that I feel that way towards.
Right. And then on the favorite side, I would say there are some clients that I've had who I really look forward to seeing for one reason or another, because I've had clients that I meet with, and after the session, I feel better about myself and I feel better about humans. I'm inspired with my own marriage. I've had couples at the end of the session, I'll run into my wife's office and hug and kiss her because I've basically watched people be good to each other and forgiving and loving in a way that I'm like, my God, I'm inspired to love my wife I want to love my wife the way these two love each other, and it inspires me. And there's a lot of different ways of answering that question. Nathan says, how can I feel more seen by my family? I often feel invisible and forgotten. Bob, what do you think?
Wow. Well, dude, Nathan's singing my song here, ain't he? I don't know off the top of my head. Why don't you do this one, and I'm going to just stew on it.
All right. Well, it might not be possible, given your scenario, Nathan, but a very quick and dirty piece of advice I would say is because often people who are invisibilized by one's family, they learn to invisibilize themselves.
Right.
So a way to not at least participate in the invisibilization of you is to be in contact with your needs. Sometimes people say, well, speak up more, but really you want to be in contact with who you are. The other thing is to be differentiated, because while you're with your family, the tendency would be to slot yourself into your normal role. But to resist that, you have to be differentiated enough to look at yourself and also be able to separate yourself from others' expectations of you. So, yeah, but this is potentially 20 years of therapy, so it's not easy to do. Did that provoke any thoughts in you, Bob?
I just want to agree.
Kimmy from Utah says, hi, Bob and Kirk. I emailed a few months ago about my husband's suicide attempt. we started couples counseling, and he has been sober from alcohol for 9 months. I was inspired by his experience to start school as a substance abuse disorder counselor, and I was inspired by his experience of struggling with alcohol, and I started a school program as a substance abuse disorder counselor, and I will graduate in 2023. However, I worry constantly that my husband is going to die, not from suicide, but from anything like car accidents, etc. My therapist says we are both codependent. What about codependency on each other is bad? What about codependency on each other is bad? How do I stop being codependent? How would this help me not worry about him dying and leaving me again? Bob, what do you think?
What do they mean by codependent?
Well, it's hard to know what the therapist means, but I think what at least Kimmy from Utah frames it as is the way that I frame it, which is that it's this personality disorder and traumas and schemas that cause the child and then the adult to primarily orient themselves around solving other people's problems. Their only worth is to solve other people's problems, and they don't even necessarily notice their own problems. And it can manifest in a lot of different feelings, like for one style is fear of something bad happening to the other person. And often these people will fit well with people struggling with addiction, because people struggling with addiction have a big noticeable problem that the codependent has the ability to focus on and not on themselves. So how do I stop being codependent, and how would this help me not to worry about him dying and leaving me again?
Okay, good description. I don't know. I'm drawing a blank.
Well, to stop being codependent requires changing one's schemas, which takes a long time, and connecting with the self and knowing your own needs, and also dispelling a lot of the automatic thoughts. Codependent people, at least in your style, Kimmy, there's this assumption, there's a lot of assumptions that are happening because of your early childhood experiences. One is that he's going to die he's very susceptible to death, is the thought. And for people in your category, when I debate with them about these cognitions, they are very, very, very frustratingly good at coming up with justifications for their codependency. They'll say like, but you don't understand, like, because, Kimmy, you bring up car accidents. You'd be like, he drives fast, or sometimes he falls asleep. One time he fell asleep at the wheel. 5 years ago, he fell asleep at the wheel, and he did get in a car crash. Or people die in the street every day, and we live in a place where there's lots of ice. And it's like, yeah, there's nothing irrational, Kimmy, about those thoughts, but it's the emphasis on them and the assumption that you're responsible for it.
Oh, yeah.
Like, okay, yeah. Same is true for me. My wife could die of a car accident tomorrow. She could die of all sorts of things. And that does not give me any kind of pleasure. Like, that's horrible to think about. But it does me no good to focus on it, one. Two, why the fuck is that my responsibility? My wife is a grown-ass woman. She can take care of herself. And sometimes I do worry, and I'll say, hey, drive safe today, or, watch out, or I'll, bring up stuff with her about her tires or something, to make sure that she's safe. So you can worry and you can take action, but this assumption that somehow anything other than you obsessing about it and trying to control it is somehow being irresponsible or not being a good wife, or, that's the problem. The thoughts, the evaluation, those are probably rational. It's the focus and the assumption that it's your job, which it is not your job. And it's annoying to other people when you make it your job. It's really annoying. So knock it off,
Well, it's probably not as easy as knock it off, but
right. But it's the schemas. So it's the self-awareness around, like, this isn't my job.
Yeah.
And okay, fine. There's a worry there. What do I do? Anything beyond that is irrational and unhelpful. And then, and then getting in touch with yourself and your self-esteem and your value outside of taking care of other people's problems.
Right. Oh, I like that.
Upper tier patron Angel says, Bob, do you ever feel any pressure from Kirk to get vulnerable or emotional on the podcast? Let's answer that one after the break. What do you say, Bob?
I feel scared.
So Bob, upper tier patron Angel says, do you ever feel pressure from Kirk to get vulnerable or emotional on the podcast?
I do not. I have a certain goal, it seems, that's developed in me over the years of doing this, wherein I wish to offer my experience, even though it is vulnerable, to provide some kind of, I don't know, window, hope, empathy, I don't know what, just something. But I don't feel you push me into anything. If I don't want to talk about something, I just won't talk about it. And you've said to me a couple of times, you sort of smile at me and you're like, oh, that one's outside your limits. Huh? You actually have something. Yeah, I do not talk about my sex life. Yes, I do not. But I don't ever feel pressure from you to do any of that. I think it's useful. I think you want me to, but I don't think you would push me to. And if I decided I didn't want to, that'd be all right.
Yeah. I'm glad that you don't feel pressure, because that would be awful.
Yeah, that would.
Also, you are just oriented this way.
Yeah, I am.
And
yeah.
I would, correct me if I'm wrong, I guess I'm asking, is that most of the time, if not all the time, you like to do this.
I do.
Yeah. Like, you would rather have those kinds of deep, vulnerable conversations than random kinds of topics.
Yes.
Right? It's hard to do, but you'd rather live in that space. You value that. It's
I do.
meaningful.
I value that.
Yeah.
Yes,
Yeah.
I do.
Yeah.
Because I value being genuine.
Mm-hmm.
So, I mean, it's not like I don't keep stuff to myself or, like to have a good time, just hang out and, crack jokes and stuff. I love that. Right. But, yeah, there's a time and a place, and I value genuineness. And so I'm this way often with my clients, hopefully not, hogging a session or anything weird like that. I did. Well, it's not exactly vulnerable, but I did tell this story once to this couple 5 weeks in a row. And they started telling me, yeah, you told us that already. And I would forget. And they're like, yeah, you told us this one already. I'm like, oh yeah, I forgot. And then finally I saw them last week and I'm like, hey, it's a different story, one I haven't told you before. And then, yeah, we all laughed about that and blah, blah, blah. Anyways, yeah, I do prefer genuineness when I'm working. I try not to be a therapist, like, assume some kind of mantle.
Yeah.
Try to just be a human.
Yeah.
Yeah. And that part of that's being vulnerable.
Yeah.
So, yeah.
Anonymous upper tier patron from Beirut. She says, "Hi, Dr. Kirk and Bob. It's been 8 months and I still feel pain and resentment over my former therapist's behavior. As therapists, how do both of you approach new clients with this kind of hurt?" So I think anonymous upper tier patron say, if I came to you and I wanted to talk about the hurt I had from a previous therapist, how do you navigate any displaced emotions that may come forward from the client? And Dr. Kirk, as someone who has supervised, how do you feel about therapists who don't always listen to you? How do you feel about therapists who don't always listen to you? So it sounds like anonymous upper tier patron from Beirut is saying that she was not listened to by a previous therapist and is thinking about going to a new therapist and possibly to talk about what happened with the previous therapist. Yeah. So how would you, Bob, navigate that and also navigate the possible displacement from that client onto you because of what happened with the previous therapist?
Well, I wouldn't think of the displacement as a problem. I think of it as their heart trying to find a solution. So if they bring displacement, if that's what comes, then that's what comes, and we get to go slow and take our time and talk about that. It would make sense, like once bitten, twice shy. So I would do what I can to help them feel safe. If I agreed with them that, the therapist made a mistake, I'd definitely not want to repeat it. So I endeavor not to. And I think I'd be as transparent as I can. It's like, you're not required to not believe that I'm different from that person. Do you want to think of me as different? Do you want to have a view of me as safe? Maybe they do, maybe they don't. They probably do, though. It sounds like, if I'm hearing right, this person wants to feel safe with a therapist, wants that. And, maybe their previous therapist, they wronged them somehow or whatever. Yeah, well, right. Why we're interested in healing, not just, people's wounds from parenthood or childhood, whatever it is, but, whatever wound wants to come in the door.
Yeah.
Yeah.
Yeah. The paradigm that Bob and I have adhered to in our hearts, not just intellectually, is that if a client is displacing or being hostile with us, it's great. It means that real stuff is happening. We know better than to interpret it as some sort of threat. It's real. And when people displace onto us, when people get upset or misinterpret us or whatever, it's our job as therapists to hold that, accept it, invite it, make it safe for the person to do it. Even if we don't agree, we're just like, I don't feel like that makes a lot of sense that they're attacking me that way. But this isn't a debate between two people. This is a client who is healing from wounds and a therapist who is the all healer. And I'm not here to defend my ego or to defend my actions. I'm here to heal. And if this person is attacking me and I don't understand why, or they're displacing onto me, or something wonky is happening in therapy, it's assumed that this is where the therapy lies. It's not in the debate as to whether or not I did the right thing or not. It's in the healing and the process of a client being vulnerable enough to be upset at me, or even just a vibe of that, and for me to be all inviting and all warm and all hearing and listening. I might even call it out. I might be like, I kind of feel like you're angry at me, which is totally fine. Is that what's happening right now? Because I want you to know that you're safe to be angry at me here. Client says, yeah, you're stupid because you're a dumb therapist. Okay, I'm not going to defend myself in that situation. Now, might I be provoked countertransference wise to do something? Sure, but that's not when I'm at my best.
Right.
Yeah. So that's what I would say. And then you ask anonymous secretary patron, how do I feel? How do I feel about therapists who don't always listen to you? As someone who is supervised. Yeah, it bugs the shit out of me. Because I've had therapists who didn't really listen to me.
Uh-huh.
I've supervised people who seemingly don't listen very well.
Yeah.
I do my best because supervision is the same as being a therapist. Yeah. I mean, it's different, but it's a similar paradigm of everyone's coming from a particular place, and therapists, they want to listen, but there's something getting in the way. And,
right.
And, I'll get into it with people. I'll say something like, as your supervisor, I'm going to tell you this, and I don't know how you're going to receive it, but it sounds to me like you're suffering from some kind of transference, and it's causing your empathy to escape you, even as you're describing your client to me right now. There's certain things you're saying. I'm not criticizing you. I'm just saying it's normal to happen, and this is a wonderful opportunity for you to learn from, we all have that client that challenges us and makes us put up defenses. This is your learning moment right now, and it's going to take time. But what you want to get to is a place where your empathy is free to flow, and it probably involves being accurate in terms of the conceptualization, because you might be saying to me cognitively right now that you understand the client from a clinical point of view, but deep in your heart you might be thinking that this client is basically choosing to be a jerk face. No one chooses to be a jerk face. I mean, unless the person's psychopathic, which I'm not hearing when you describe this client. It sounds someone that has relational traumas that is causing them to be a jerk face to you, or resistant, or annoying to you in whatever way,
right.
Or resemble someone in your past, but that's not often the case. And I might even ask, what kind of therapist do you want to be? Do you want to be a surface level therapist? And there's nothing wrong with that. There's a lot of surface level therapists who work quote unquote pragmatically, and they don't want to think about this stuff. And you got to advertise yourself as such, but that's okay. And I'll supervise you. And I've supervised people like that before. But if you want to be a true therapist, someone that really gets into it with people and really wants to help, particularly those people that are difficult, then tell me now. Because if you want to be that person, I can show you the path. But it's not easy. I'm guessing you didn't think this was going to happen when you signed up to be a therapist, that you were going to have clients that are that keep you up at night and really rock you to your core, that really get under your skin. So what kind of therapist do you want to be? Usually they're going to say, I want to be a true therapist. So, okay. So this is what we've been talking about in the program. This is what we've been talking about it. We've been, person of the therapist, countertransference, family of origin, your own schemas, all this stuff. Now is the time when you put it into action. And if you can get through this, I can almost guarantee you on the other side is a very different paradigm, a very different place for you as a clinician, but also as a human being. It's a different world on this other side of this threshold, but it's not going to be easy. And you're going to have to discard a lot of assumptions and ways that you think, because it's very normal for Americans, maybe people around the world, to think along the lines of, that person is being unfair. I hate them. I reject them, essentially, I'm not to blame. They're to blame. and they're to blame, so they need to know they're to blame. The client is to blame, that kind of stuff. Yeah. And it's a very different paradigm to say that. You'd be like, yeah, the client's to blame, I think, maybe, but I am here to heal. A physician doesn't throw someone out of their office because they have a diagnosis. They don't say like, how dare you come into the ER with a broken arm? That inconveniences me. They accept and they heal. And maybe the patient is saying, fix my arm, God damn it hurts, and the physician doesn't say, get out of my office. They're like, yeah, I get it hurts, let me help you. Or an infant who doesn't want treatment, doesn't really even understand why they're being prodded and poked at. You have compassion, you love that infant, even though that infant hates you in that moment, but that this is what's going to help them. It's a weird metaphor in therapy, but anonymous patron, she says, Dear Kirk and Bob, I wanted to write and say thank you because I found listening to the podcast to be a real help and comfort to me. In all this process, there was a lot of rupture and repair. In all of this process, there was a lot of rupture and repair, meaning in her past relationship. However, there were many times I invented problems like, I'm mad at you because I think you're sitting there wishing you were somewhere else. Oh, okay. So anonymous patron is talking about a lot of rupture and repair in a previous therapeutic experience.
Oh.
However, there are many times I invented problems like, I'm mad at you, therapist, because you're just sitting there wishing you were somewhere else. Could you say something about rupture and repair and how it can be helpful even though it feels awful at the time? Do you roll this all in with corrective experience, or do you see it as its own topic? Bob, what do you think?
I think everything you said about in the previous one is sort of on target for responding to this question. What was the last bit? Do you what?
Do you roll this all in with corrective experience, or do you see rupture and repair as its own topic?
I roll it all in. It's all the same.
Yeah, what I would say is that it's under the umbrella of corrective experience, rupture and repair, for sure. You're asking us to say something about rupture and repair and how it can be helpful even though it feels awful at the time. We might talk about rupture and repair as somehow it's this like wonderful experience to repair. It's not. It's awful. It's awful, particularly for the client, because it's not like you walk away from effective repair and say like, oh, that was great. The residual shame and worry and upsettedness and did I do the right thing? It's all going to be there. And when we have significant relational traumas that are affecting us naturally in therapy and in our lives, it's hard. They fold in on each other. The relational trauma gets triggered, we react, and we might do things that are unfair, or we build a tension with our therapist, and then that needs to be repaired. But because we have the relational traumas, it affects us in terms of the repair because we can be a little complicated during the repair. And then it affects us after the repair because the old voices start to kick in again of just like, I'm a terrible person, or I can't trust other people. It all just folds into each other, but you keep going down the road and eventually it gets easier.
They call that earned secure attachment, right? You get to do that. There's a solemn pride that goes with that, but it isn't because it's not like you look back and say, hey, that was really fun. Mm-hmm. You earned it. Mm-hmm. You earned what could come of it, but it's because you survived whatever. Right. And you and the therapist stayed together through it.
Yeah. What a wonderful thing, to be able to trust someone. Now, I will say that some repair can be very euphoric and be very pleasurable.
Right.
And you can walk away with a feeling of security pretty quickly. But if you have significant relational traumas, like I said, that's harder to achieve because you have good reasons to distrust other people and to be wary of what they're saying. There's reasons for that. Patron Emmy from France, she says, hello, thanks for everything that you do. I've been watching your content for a long time, and I've learned long and clear conceptualization of anxious and avoidant attachment style, especially from your reaction videos, helping me to really empathize with those insecurity styles. But don't feel like you've ever gave such a heartfelt explanation of fearful attachment. But I don't feel like you've ever given such a heartfelt explanation of fearful attachment. I've listened to your podcast with Bob on the subject, yet I haven't felt like I've heard a comprehensive conceptualization of this style, at least not one that my head could wrap itself around. I guess my question is, could you give a clear conceptualization of fearful attachment or disorganized attachment where we really understand what the individual is going through internally? Or is it harder to do such a thing due to these attachment specificities. Thank you, and have a nice day, Emmy. So, Bob, how would you explain disorganized or fearful attachment style?
Me and Colleen was having this fight. This is a couple years ago. It was a Sunday. We were in the kitchen or whatever, and my dining room's attached to the kitchen or whatever, and I don't know what was going on, but we were at this fucking standstill. It was just terrible. And I remember just standing there with my back to her, facing the table, the dining table, and feeling completely frozen. Like, I don't know what to do. I don't want to attack. I don't want to leave the room. In fact, I don't even want to move. I don't want to be seen moving. I just feel frozen. It was terrible. And
like trapped, nowhere to go. I don't want to leave. I don't want to.
Right.
I don't want to say anything.
Right. There's no good place to be. Leaving is worse. Trying to get somewhere is worse. It's all worse.
Emotionally trying to work it out. Is worse.
Yeah. It's just worse. And there's nothing I can do. And I remember feeling like I was in this weirdo altered state where there was cold on the back of my neck, and I felt, I guess they call that numb. I was sort of checked out, like didn't feel like things were real, like this was like a real thing. I mean, it felt they call it derealized, right? When you don't feel like you're in reality anymore or whatever. And
like that far into that feeling, actual dissociation, or
I didn't lose time, nothing like that. But yeah, I was definitely numbed out or checked out or emotioned out or whatever out. But just definitely frozen. Like I didn't want to move. Like I literally did not want to move. Mm-hmm. I didn't want to shift my weight because she might hear me. I didn't want to turn around. I didn't want to do anything. I just sort of and I remember just staring at the table for 2 minutes, just staring at the table, not knowing, like, just nothing to do. I don't know what's going to happen. It's probably bad. And yeah, that just sucked.
High adrenaline?
I don't remember. That's a good question. I don't know. Probably.
High distress?
Yeah, for sure. Yeah, for sure. Another time I had a similar thing like that, and I went to the freezer and I grabbed a bag of frozen corn and shoved it on my face and held it for a half minute and hold my breath. That's what you're supposed to do. It shifted my physiology dramatically.
Would it have helped that other time you said?
Oh, yeah. If I stuck some frozen corn on my face on that moment, it would have settled my body down, and I probably would have had more access to, this part of my brain, my brain, and being able to, navigate right. Whatever that is. So the way I understand that when I think about that is the folks with the disorganized style, they don't have a defense. It's not like they can just distract by watching a football game, or that they turn to the other and they pursue them, in some maybe a naggy way, or maybe a argumentative way, or maybe a whatever, or even that quiet version of pursuit where you're just sort of like thinking about, well, what am I going to do here? And how At least those folks have a strategy. That's the thing about those styles, is you have a strategy. It may not work, and and
it might be equally as distressing, obviously.
Yeah. But at least there's something. I can at least watch the football game if that's what it is, or whatever. I just was frozen. It was shitty.
Yeah, it's an excellent example of something straight down the middle, fearful, disorganized attachment, which is, so fast to intellectualize what you're talking about a little bit, is that when we observe the children, they'll have the same reaction. And adults tend not to do this specifically, but they can, like you did. So when you were a kid, in all likelihood, you went through experiences so the idea is that when children and adults as well are threatened, they run to their attachment figure to have a secure base to protect them and to feel safe and, to get support. And the 18-month-old child, when they see a stranger or a scary animal or something, or they're sick, they run to their attachment figure. But when the threat is the attachment figure, when the attachment figure is the person who is abusing you, you don't know which way to go. You want to run away from the threat and toward the secure base. But if the secure base is the threat, the child will freeze, or they'll collapse on the ground, or they will run in circles, or they'll scream, or, they don't know where to go. The avoidant kid will turn away and play with the toys. The preoccupied kid will cry and run toward the attachment figure and cling. The disorganized kid doesn't know what to do. Their brain kind of short circuits because everything is pulling in different directions. And also disorganized kids, fearful attachment kids tend to go through more abuse, but not always. I don't want to paint preoccupied attachment or avoidant attachment because it sometimes is framed this way, and sometimes I might do this, that somehow it's better or somehow more preferred. It isn't necessarily.
It is better. No.
Disorganized fearful attachment is definitely unpreferred. It's not likely that people have light versions of disorganized or fearful attachment style, whereas you can have light versions of avoidant or preoccupied, but you can have extremely intense preoccupation and avoidance that will ruin your life in a similar fashion that disorganized and fearful will. So there's that. I don't know, Emmy, what you're hoping, what more you want from me. I think it's possible that, because I feel like I've talked about this before, and certainly Bob and I have, but it's possible that, Emmy, you either can't relate to it very much, or you can relate to it a lot and just want more empathy from us regarding the explanation or something like that. I don't know. Mm-hmm. It's horrible, that feeling that Bob describes of just being trapped, and it's the fear, right? That's what you're feeling. It's just intense, unnamed fear, And the fear is complete distrust and hatred of the self, and complete distrust and hatred of others. Maybe not hatred of others, but like no trust that anyone will be there for you, no trust that anyone will listen to you or hear you or care about you. That is a horrific place to live in, where you're just alone and convinced that not only can you not depend on others at all, but you also can't depend on the self. There's like nowhere to turn. There's just emptiness and terribleness in every direction. And so you either freeze or you, drink or get angry or scream, or I don't know. There's a desperation involved in it that is, one of the most horrific emotional experiences one could have. And it could be set off, as you often talk about, Bob, by a simple misunderstanding with your wife. Yeah. Just like a little misunderstanding that kind of grows, and before long you're dissociating and standing in the kitchen and just frozen in fear for several minutes. And if you've never been there, it might be hard to kind of relate to that, but if you have, then you know what that feels like. It's extremely unpleasant, and it compounds, because every time that happens, it's further incursion on your trust of yourself and other people. It's like your body encodes that again as like, yeah, it's true. I can't depend on myself. I can't depend on others. It's true. People are a threat at any moment. I can be emotionally thrown to the wolves, that's around every corner. Right. I mean, yes. So it's not, it's extremely distressing. We might talk about it in an intellectual way, I suppose, but
it's hard to illustrate. It'd be hard to, yeah.
And without awareness, Bob has tremendous awareness, but if you don't, then you're completely lost to your own perspective as well. You start having some real odd beliefs based on your experience. Like, some people will convince themselves that other people are horrible, or that they are horrible, or that relationships aren't worth it or something. There's a lot, or therapy never works, or, there's a lot of cognitive conclusions that people will come to that will make the matter worse. You know what I mean? Patron Carrie from Ohio, she says, "Dear Kirk and Bob, I began seeing a long-term therapist shortly after being diagnosed with borderline personality disorder, and all that entails at 22 years of age. I'm now 47 and just started to dig into multiple traumas and abandonment issues. It's been difficult, but I've had the same therapist for 23 years. It took me 10 years to tell him anything of substance." So just chiming in here, she's saying 47, borderline, 10 years of therapy with this therapist to finally kind of open up to him. Right?
Wow.
He became ill last spring, but has been getting better and planning on returning to work. Unfortunately, he died unexpectedly 2 weeks ago.
Oh, God.
Since then, I've been having panic attacks and tons of anxiety. I have a psychiatrist I've been seeing weekly since my therapist became sick, and I already have an appointment with a new psychologist in December. So a couple months ago, last month. Wow. However, I am wondering how to begin with a new therapist after all this time. Do I start all over? Will it take 10 years for me to trust him? I know I must stay in therapy to survive, but it is overwhelming. Any advice on starting over after such a devastating loss, Bob?
I like how you put it, a devastating loss. That is the truth. Wow, you lost somebody so important to you.
Yeah.
Wow.
Yeah, I mean, it's like if your partner dies, your close friend dies, that's obviously horrific.
Yeah.
There's something laterally equally horrific about losing a therapist because of not only are they important humans to us, but they're our lifeline to healing, and and it takes a long time to develop that and to find the right therapist. It's like losing the ability to eat food, or so. It's more than a relation. It's more than an attachment. It's a functional attachment. This therapist who gets it.
Yeah.
Yeah. It's a humongous loss. Yeah.
Wow.
And traumatic. Just all of a sudden, boom.
Right.
Just dies out of the blue. I mean that. Ugh.
I don't know if I have any good advice except to hold it loosely. It's going to be weird to start.
Will it take 10 years to trust?
I don't know. But I think that this person, one of the things that they have going for them is the ability to articulate that it took 10 years to trust, to tell the person, anything. You can actually start there saying it took me 10 years. And you're already doing it. You're telling something really deep and personal, and you're already beginning to invest in the relationship itself, and because that's going to be the resource for healing. So, I think you're on the right track, but I'm sorry. And this clearly like grieving, like there's just, that's going to be part of your knowing and learning with the new therapist is grieving the loss of the old, and the brain's going to do the comparisons and be good to be transparent about that as best you know how. So anyways, I'm really sorry. How awful.
Yeah. Yeah. The only thing I'll add is there's a really good chance it won't take you 10 years, especially if you find the right therapist.
Yeah. Right.
It could literally take you 6 months.
Yeah.
It'll probably take a bit, but it could take a pretty short amount of time.
You've already got these many years under your belt, and this earned security with the right. So no,
what it feels like too. Like maybe try to get there earlier.
Right.
What it feels like to be open and trusting.
Yeah, you're not
find the right therapist, of course.
Yeah, right. So no, I don't think it'll take 10 years either. That's sorry, I missed that part.
Yeah. I mean, it could, but I don't know. It doesn't seem likely.
It doesn't seem likely. No.
Yeah. Well, let's take a break. We'll get back. Just answer one or two more. What do you say, Bob?
Yep.
All right, just a couple more here, Bob. Patron Joyce from the Bay Area says, "Hi, Dr. Kurt Honda, Kirt."
Oh, is that a new one?
No, I've seen all spellings of my name. Yeah. Curk. Yeah.
Kirk.
Yeah. Dr. Kurt Honda and Bob, how do I break this feeling of abandonment and emptiness regarding my borderline personality disorder? And by the way, Joyce, you're fine. You can misspell my name. I don't take it offensively. It's fine. It's probably just a typo anyway. But how do I break this feeling of abandonment and emptiness regarding my borderline personality disorder, Bob?
How do I break this feeling of abandonment and emptiness? Let's leave the borderline part out. How do I break this abandonment and emptiness? Well, I'd say by developing connection and experimenting with trust and being, choosy about who you put your faith in, but nonetheless, there are people that are, trustworthy. 100%? No, nobody's 100% anything. But there are people that are reasonably trustworthy. And so I think the way to break abandonment is to develop connection with people around you. Mm-hmm. And I'm not saying, it's a very easy thing to say. And it's a scary thing to do because, your body's going to feel like you're taking your life in your hands by opening up to somebody or telling them a little bit about yourself, etc. I feel that way sometimes. I'm giving you a straightforward answer to a straightforward question, but it's scary. That would be scary for anybody. So it's likely to be scary. It's doable.
Takes a long time. Listener Rose from California says, "Dear Dr. Kirk and Bob, I'd love to hear your input on self-help books, such as the Borderline Personality Disorder Workbook by Daniel J. Fox." Have you heard of that one?
No.
Can you imagine what's in it?
I can.
Yeah. It's pretty typical books along these lines.
So like a lot of CBT or maybe DBT adapted stuff. Yeah.
Yeah. Redirecting, this kind of stuff. Are they more effective than working with a therapist, these books, or can progress be made with completing them independently. Bob?
I don't think there's a substitute for having a relational experience with a real person. I think that the workbooks are going to aim you at experiments with real people. They're not going to be like, you just do this, that, or the other. They're going to involve how you interact with others. That's going to be, a lot of the stuff in the book is going to be about coaching you about how to do that effectively, so that you can have a different experience of, whatever. But I don't think that they are a substitute for working with a therapist, or for working more broadly, for working relationally with the world that you're in order to help yourself heal.
Yeah, that's a good way of putting it.
Thanks.
Well, the research on this is varied, but from my memory, on average, to just have a workbook with borderline has limited success. Now, can someone do better than going to therapy by using a workbook like this? Yeah, but the bell curve is such that that's not likely to happen. On average, it's best if you find a specialist and maybe also do this workbook or something similar to it.
Yeah.
But it depends on who you are and how aware. I mean, I would imagine that if someone used a self-help book like this, they would have to be extremely self-aware.
Yeah.
And they'd have to be very good at engineering corrective emotional experiences, and very good at not falling for a lot of pitfalls that people like this would have. I would venture to say, if someone was succeeding in this way, that they had a mild case of borderline. It's there, but they're able to differentiate. You have to differentiate. You have to be able to look at yourself and say, yeah, my perception or my assumptions or my behavior is not justified, or it's in relation to my past traumas. I mean, the borderline people that I work with that are moderate to severe, it takes years for them to even kind of accept the possibility that they are distorted in their thinking and their perceptions. It's really hard for them, even though, I can come at it from a lot of different angles. It takes a long time. So for those people that I'm thinking of, moderate to severe, if they use a self-help book, they'd be like, well, I'm fine. Everyone else is crazy, so.
Right. They might not even pick up a self-help book or think that it were necessary.
Yeah, exactly. Last couple of questions here. Patron Lena from Seattle, she says, have you ever known a therapist who has been diagnosed with borderline personality disorder? I would like to attend college for pediatric psychology and behavioral health, but I have diagnosed borderline. Have you ever known a therapist who has been diagnosed with any kind of personality disorder that is still able to practice? My borderline affects my personal life, but it doesn't seem to affect my studies or work. Bob?
Yeah. Am I supposed to name names?
No.
I have known therapists that have borderline personality disorder, and I think they're very good therapists. So I don't think that the thing in itself is a precluder for that. And it sounds like your own experience, Lena, is that you can function really well in the world of work or the world of school. And it's where you're making personal connection with people that the relational traumas show up. That really makes sense. It might be, though, that as you kind of get into working with kids, they're going to hit a raw spot or a trigger spot for you, and you're going to, have a response to them based on relational trauma. That's not a bad thing. That's why we have supervisors and consultants and, colleagues, etc., to help us with that, because just because they're a kid doesn't mean that they're not powerful or not going to trigger us. Kids are marvelously powerful and can be very triggering at times. Yeah. Absolutely. I know therapists professionally and personally who have various different personality disorders, including borderline. And I've trained some therapists who had borderline, told me they had borderline, and they are some of the best therapists that I know. I understand why you'd be a little worried, but there's nothing to worry about. There's pros and cons. The pro of having borderline is that you understand borderline. Yeah.
Which also extends to attachment, insecurity, and distortions in general,
right,
and all that. So that's a huge plus.
Yes.
Another plus to being borderline is you're pretty attuned to other people's feelings,
right,
and have kind of a big radar dish on top of your head that is dependent on knowing other people's states.
Right on.
You can be distorted about it, but if you tune in well enough, you can actually have more empathy and more assessment of other people. The downside is, as Bob was saying, you could get triggered, you could get distorted. You could also be just personally affected by things that are happening in therapy. especially if you're working on pediatric psychology, that you could imagine targeting parents or something with your issues. But all of us have that as a thing. There's just something particular about someone with borderline with that. I would say that the other pitfall, which isn't the case with you, Lena, is that if someone has a personality disorder, they don't know it. There's plenty of people who are in training programs who have personality disorder and they don't even know it. And I've trained students who seemingly were like that, and there's various different ways of dealing with it depending on the situation.
And how willing they are to hold a mirror up.
Yeah.
Yeah.
And it gets hard,
Yeah.
and sometimes we have to kick people out of the program because they aren't willing, because it's not that they have personality disorder, it's that they aren't willing to look at themselves or take responsibility or something.
Right.
And it's affecting their work with their clients, and that happens.
Yeah.
But if you're aware of the fact that you have borderline, in all likelihood, you're okay.
Yeah.
It's the people who don't recognize that they have a
Right.
problem.
So go forward, Lena.
Mm-hmm. Last question for today. Up to your patron, Rain Lyons says, Dear Psychology of Seattle, thank you again for your compassionate, thoughtful insights regarding cluster B personality disorders. Rain Lyons goes on to describe her schemas as a result of her relational traumas. Then she says, what truly is the most effective way of dealing with this to become healthy in our relationships to selves and others? EMDR? I was so close to getting into that with my last great therapist, EMDR, but had too much here and now we got bogged down in. I've been through DBT and it's incredibly helpful, but sometimes I lose sight of it. Any other specific suggestions, Bob?
Yeah, it's easy to lose sight of DBT. I've had students come back to take a refresher or whatever. That's not a bad idea. If you found it helpful the first time, why not? But I have a bias here in that I'm relationally oriented, and so my thing is going to be not EMDR or even DBT, but a relationally oriented personal counselor or whatever, or if you're in a relationship, one that's a relationally oriented couple therapist, if that's what you're seeking. So that's my bias. I'm not saying the other things aren't valuable. They have their place, absolutely. But if it were me, that's what I'd be thinking.
Totally, yeah. EMDR, fine, but it's limited in its ability to treat cluster B in terms of long term. It could be a good bout to do in the scheme of the whole treatment, and maybe you can find an EMDR therapist that is also relationally oriented. I guess perfect world, you'd find someone that's DBT oriented and also relationally oriented like Bob is. So yeah, that's what I would say to that. It's hard to find a therapist like that, but once you find one, hold on to them. All right. Well, that does it for that episode of Psychology in Seattle. Everyone out there, please take care of yourself because
you deserve it.